Question 1. Which of the following is the most important ethical consideration when handling animals in a research setting, especially in studies involving invasive procedures? A. Ensuring that the research findings are published. B. Ensuring the physical and psychological well-being of the animals during the study. C. Limiting the number of researchers handling the animals. D. Providing animals with unlimited space to move free. Answer B. Ensuring the physical and psychological well-being of the animals during the study. Explanation. In animal research, ethical considerations are paramount, particularly when invasive procedures are involved. The most important ethical principle is ensuring that animals' physical and psychological well-being are maintained throughout the study, according to the Australian Code for the Care and Use of Animals for Scientific Purposes. Researchers must provide proper care and ensure that any distress is justified by the potential benefits of the research. While other options, C and D, may seem beneficial, they do not directly address the welfare of the animals. The 5 freedoms of animal welfare, freedom from hunger, discomfort, pain, injury, and fear, guide ethical research practices, emphasizing the need for humane treatment, proper care, and minimizing distress. Question 2. Mr. Brown is a senior animal care worker in a shelter that houses a variety of species, including dogs, cats, and rabbits. He notices a rabbit showing signs of severe gastrointestinal distress. The rabbit is lethargic, not eating, and is producing a liquid, green-colored stool. What should Mr. Brown do first in this situation? A. Wait for the symptoms to resolve on their own, as they may not be serious. B. Immediately administer over-the-counter medication to relieve gastrointestinal discomfort. C. Isolate the rabbit from other animals and contact a veterinarian for further assessment. D. Provide the rabbit with extra food and water to encourage eating. Answer C. Isolate the rabbit from other animals and contact a veterinarian for further assessment. Explanation. In the given scenario, Mr. Brown should isolate the rabbit from other animals and contact a veterinarian immediately. The symptoms described, lethargy, loss of appetite, and abnormal stool, are concerning and could indicate a serious condition such as gastrointestinal stasis, which is common in rabbits. This condition can be fatal if treated promptly. Prompt veterinary intervention is crucial to diagnose the issue and provide appropriate treatment. Isolating the animal is important to prevent the potential spread of infectious diseases to other animals. The other options, A, B, and D, are not appropriate. Waiting could allow the condition to worsen, while over-the-counter medications, B, may not be safe without proper diagnosis. Providing extra food and water, D, could aggravate the issue if the gastrointestinal system is compromised. Question 3. Which of the following is the most effective method for reducing the risk of zoonotic diseases in an animal care environment? A. Limiting animal contact with visitors and volunteers. B. Ensuring proper hygiene and sanitation practices in animal care facilities. C. Regularly rotating animals to different enclosures. D. Offering regular vaccinations only to high-risk species. Answer B. Ensuring proper hygiene and sanitation practices in animal care facilities. Explanation. The most effective method for reducing the risk of zoonotic diseases in an animal care environment is to ensure proper hygiene and sanitation practices. This includes regular cleaning and disinfecting of animal enclosures, proper disposal of waste, and ensuring that caregivers practice thorough hand washing, especially after handling animals. Zoonotic diseases spread through contact with animal saliva, urine, feces, and even through aerosols. Proper sanitation reduces the likelihood of pathogen transmission. While limiting contact may reduce risk to some degree, it does not address the root cause of disease transmission. Rotating animals, C, and offering vaccinations, D, are helpful but do not replace the importance of basic hygiene practices. According to the Centers for Disease Control and CDC, hygiene and sanitation are foundational in preventing zoonotic outbreaks in animal care environments. Question 4. Which of the following is a critical aspect of ensuring appropriate animal welfare in a research environment where animals are used for testing new pharmaceutical products? A. Reducing the number of animals used to the bare minimum required. B. Allowing animals to roam freely in large outdoor enclosures to promote natural behaviors. C. Ensuring that all animal care staff are not required to undergo animal welfare training. D. Ensuring the animals are kept in isolated environments to prevent disease transmission. Answer A. Reducing the number of animals used to the bare minimum required. Explanation. The ethical principle of the three is in animal research. Replacement, reduction, and refinement focuses on minimizing harm and the number of animals used in testing. According to the Australian Code for the Care and Use of Animals for Scientific Purposes, one of the key requirements is to reduce the number of animals used in research to the minimum necessary to achieve valid results. This is critical to ensuring that animals do not suffer unnecessarily. Allowing free roaming, or isolating animals may not be practical for research purposes and could compromise welfare, while animal welfare training is essential for staff but not related to reducing the number of animals. Question 5. Which of the following factors should be considered when designing an enclosure for a small mammal like a guinea pig in a shelter environment? A. The enclosure should only be large enough for a guinea pig to turn around comfortably. B. The flooring should be hard and smooth for easy cleaning. C. The guinea pig should be housed alone, as they are territorial animals. D. The enclosure should provide enough space for exercise and opportunities for mental stimulation. Answer: D. The enclosure should provide enough space for exercise and opportunities for mental stimulation. Explanation: when designing an enclosure for a small mammal such as a guinea pig, it is essential to provide enough space for exercise and opportunities for mental stimulation. Guinea pigs are social animals and thrive when they have space to explore, interact with enrichment items, and engage in natural behaviors. According to animal welfare guidelines, appropriate enrichment, e.g., hiding places, tunnels, toys, and room for movement are critical. Option A is incorrect because a guinea pig needs more space than just turning around. B. Smooth, hard flooring may lead to discomfort as guinea pigs need soft bedding to prevent injury. And C is wrong because guinea pigs are social and should ideally be housed with companions. Question 6. Which of the following is a key responsibility of animal care staff when handling animals with behavioral problems? A. Using physical punishment to stop undesirable behaviors. B. Ignoring the behavior and focusing on the animal's physical health instead. C. Identifying the root cause of the behavior and using positive reinforcement techniques. D. Removing the animal from public areas without providing any behavioral intervention. Answer: C. Identifying the root cause of the behavior and using positive reinforcement techniques. Explanation: handling animals with behavioral problems requires identifying the root cause of the behavior and applying positive reinforcement methods. Positive reinforcement involves rewarding desired behaviors, which is an effective method for encouraging positive changes. Physical punishment can harm the animal's trust and cause further behavior issues. Ignoring the behavior, B, can allow the problem to escalate, and removing the animal without addressing the behavior, D, does not solve the underlying issues. Behavioral modification strategies, such as using reward-based training, are grounded in animal welfare principles and are critical for successful intervention. Question 7. Which of the following best describes the role of nutrition in the overall health management of farm animals? A. Proper nutrition is solely about providing enough calories to meet the animal's energy needs. B. Proper nutrition is only necessary during specific growth stages, such as infancy or pregnancy. C. Balanced nutrition is essential for preventing diseases, promoting growth, and improving reproductive performance. D. The nutritional needs of farm animals are uniform and do not vary between species. Answer: C. Balanced nutrition is essential for preventing diseases, promoting growth, and improving reproductive performance. Explanation: proper nutrition plays a critical role in the overall health management of farm animals. A balanced diet is necessary to support the animal's growth, immune system, and reproductive performance. According to the National Research Council (NRC) guidelines, farm animals need a mix of proteins, carbohydrates, vitamins, and minerals to maintain health and productivity. Nutritional deficiencies can lead to diseases, poor growth rates, and reproductive issues. Option A is incorrect as it only considers calories, and B overlooks the need for consistent proper nutrition across all stages. Option D is also incorrect, as different species have distinct nutritional requirements based on their physiology and environmental needs. Question 8. A new veterinary technician at an animal care facility is unsure how to administer a medication to a dog that requires an oral dosage. What should the technician do first to ensure the proper administration of the medication? A. Administer the medication immediately without further steps, as it is a simple task. B. Read the medication instructions carefully, including dosage and any warnings. C. Wait for the supervising veterinarian to give instructions before taking any action. D. Administer the medication by crushing it and mixing it with food for easier ingestion. Answer: B. Read the medication instructions carefully, including dosage and any warnings. Explanation: before administering any medication, it is crucial to read the medication instructions carefully, including the correct dosage and any specific warnings or precautions. This ensures that the correct medication is given at the right dose, which is vital for both the safety and well-being of the animal. Option A is not advisable because it is important to be thorough. Waiting for the veterinarian. C is unnecessary if the instructions are clear, and crushing medication. D can be inappropriate for certain drugs as it might alter their effectiveness or safety. Following the proper protocol is a key responsibility of animal care staff. Question 9. In an emergency situation where a fire breaks out in an animal shelter, which of the following is the first priority for the staff? A. Trying to extinguish the fire themselves. B. Ensuring that the animals are safely evacuated from the building. C. Notifying animal owners about the situation. D. Collecting any valuable equipment and documents from the shelter. Answer: B. Ensuring that the animals are safely evacuated from the building. Explanation: in an emergency, the safety of the animals is the highest priority. According to fire safety protocols, staff should ensure the animals are safely evacuated first before attempting other tasks. Evacuating the building and preventing harm to the animals takes precedence over extinguishing the fire or securing equipment and documents. D. Notifying animal. C is important but can be done once the animals are safe. Shelters should have an emergency evacuation plan in place, focusing on animal safety in the event of disasters. Question 10. What is the primary function of environmental enrichment for animals in captivity, and why is it important for their welfare? A. It is meant to make the enclosure look aesthetically pleasing for visitors. B. It encourages natural behaviors, reduces stress, and improves overall mental well-being. C. It is intended to train animals for human interaction. D. It provides food for the animals in a more enjoyable way. Answer: B. It encourages natural behaviors, reduces stress, and improves overall mental well-being. Explanation: the primary function of environmental enrichment is to promote the well-being of animals by encouraging natural behaviors, reducing stress, and enhancing mental health. This includes providing physical and cognitive stimulation, which can reduce the likelihood of stereotypical behaviors or aggression that arise from boredom and frustration. According to the 5 freedoms of animal welfare, animals in captivity must be allowed to express normal behaviors. Option A focuses on appearance. C focuses on human interaction rather than animal needs. And D relates to feeding but does not address the broader need for enrichment. Proper enrichment is a key aspect of promoting animal welfare. Question 11. When setting up a quarantine area for newly admitted animals at a shelter, which of the following considerations is most important to prevent the spread of disease? A. Allowing the new animals to mingle with other animals in the shelter to promote socialization. B. Ensuring that the quarantine area has separate ventilation and is isolated from other animals. C. Placing the animals in common areas to allow them to become accustomed to the shelter environment. D. Providing enrichment immediately to help the animals adjust to their new environment. Answer: B. Ensuring that the quarantine area has separate ventilation and is isolated from other animals. Explanation: the most important consideration when setting up a quarantine area is to isolate newly admitted animals from the general population to prevent the spread of diseases. Separate ventilation ensures that air from the quarantine area does not mix with air in other parts of the shelter, reducing the risk of airborne diseases spreading. Mingling. A. Placing animals in common areas. C. Or providing immediate enrichment. D. Could compromise the quarantine process and increase the risk of disease transmission. Question 12. Which of the following is an example of proper handling of a small animal like a rabbit to minimize stress and injury? A. Lifting the rabbit by its ears to prevent it from jumping away. B. Holding the rabbit firmly with both hands, ensuring its body is supported at all times. C. Letting the rabbit roam freely in an unfamiliar environment to explore on its own. D. Grabbing the rabbit quickly by the back legs to prevent escape. Answer: B. Holding the rabbit firmly with both hands, ensuring its body is supported at all times. Explanation: the proper way to handle a rabbit is to support its body fully with both hands to prevent injury or stress. Lifting by the ears A. is painful and can cause injury, while grabbing the back legs D. can dislocate joints or cause distress. Letting the rabbit roam in an unfamiliar area C. without supervision can cause stress or injury. D. Animals' instinct to flee in unfamiliar surroundings. Proper handling is key to ensuring animal welfare and minimizing stress. Question 13. Which of the following behaviors in an animal would indicate A possible sign of stress or poor welfare: A dog wagging its tail and seeking attention. B, a cat hiding in a quiet, secure space. C, a rabbit eating and grooming regularly. D, a bird chirping and interacting with other birds. Answer: B, a cat hiding in a quiet, secure space. The explanation: while hiding can be normal behavior for some animals, a cat hiding in a quiet space could be a sign of stress, fear, or discomfort, especially if it is a drastic change from its usual behavior. Stress can cause animals to seek isolated areas, avoid interaction, or exhibit signs of distress. Tail wagging, neigh, eating and grooming. C, and chirping. D, are generally positive behaviors suggesting well-being or contentment, but they should always be considered in context with other signs of health. Question 14. Which of the following should be done first when treating an injured animal at a shelter? A, administering pain relief medication immediately. B, ensuring the animal is safe and restrained to prevent further injury. C, providing food and water to stabilize the animal's condition. D, calling the animal's owner to inform them of the injury. Answer: B, ensuring the animal is safe and restrained to prevent further injury. Explanation: the first step when treating an injured animal is to ensure its safety and restrain it to prevent further injury. Restraint prevents the animal from moving in a way that could worsen the injury. Administering pain relief aid should only be done once the animal is safely restrained, and giving food or water at C might not be appropriate depending on the condition. G, in case of internal injuries or shock, notifying the owner. D, should also be done later, after immediate care has been provided. Question 15. Which of the following is an important aspect of designing an effective enrichment program for zoo animals? A, ensuring that all enrichment activities are designed to be visually appealing for the visitors. B, focusing only on physical enrichment, such as toys and climbing structures. C, providing a variety of enrichment activities that encourage species-specific behaviors and mental stimulation. D, restricting access to enrichment activities to prevent overuse and keep the animals interested. Answer: C, providing a variety of enrichment activities that encourage species-specific behaviors and mental stimulation. Explanation: an effective enrichment program for zoo animals should include a variety of activities that promote natural, species-specific behaviors such as foraging, problem-solving, and exploration. Mental stimulation is as important as physical enrichment. The goal is to reduce stress and boredom, improving the welfare of the animals, while making enrichment visually appealing. A, may be a secondary consideration. The primary focus should be on the animal's needs. Focusing only on physical enrichment. B, or restricting access. D, would limit the positive effects of enrichment. Question 16. In animal welfare, which of the following actions best demonstrates the ethical treatment of farm animals? A, keeping cows in small, confined spaces to maximize milk production. B, providing adequate space for pigs to engage in natural behaviors such as rooting and socializing. C, using electric shock to move animals quickly during transportation. D, allowing chickens to live in overcrowded conditions for cost efficiency. Answer: B, providing adequate space for pigs to engage in natural behaviors such as rooting and socializing. Explanation: the ethical treatment of farm animals focuses on providing adequate space, enrichment, and the ability to engage in natural behaviors. Pigs, for example, need the ability to root and socialize, which contributes to their well-being. Keeping animals in confined spaces, A, or overcrowded conditions. D, or using inhuman practices like electric shock. C, violate ethical standards and fail to meet animal welfare principles. The 5 freedoms of animal welfare, which include freedom from discomfort, hunger, and fear, are central to these considerations. Question 17. Mr. Green is a veterinary technician in a shelter. He notices that one of the dogs, a German Shepherd, has been eating less and acting lethargic over the past few days. What should Mr. Green do first? A, immediately treat the dog with antibiotics and monitor its progress. B, provide the dog with a special diet and observe it for the next week. C, isolate the dog and take it to the shelter's veterinarian for an assessment. D, wait for the dog to recover on its own before taking any further action. Answer: C, isolate the dog and take it to the shelter's veterinarian for an assessment. Explanation: in this scenario, the dog is showing symptoms of illness, including loss of appetite and lethargy, which could indicate an underlying health problem. The first step is to isolate the dog to prevent potential spread of infectious diseases and immediately take it to the veterinarian for proper assessment. Treating with antibiotics, A, without diagnosis, harmful. Providing special diet, B, might not address the root cause of the problem, and waiting for the dog to recover on its own, D, could allow the condition to worsen. Question 18. Which of the following is a key principle of animal behavior modification that should be considered when working with aggressive animals in? Is shelter A, using punishment techniques to reduce aggressive behaviors immediately? B, ignoring aggressive behavior until it stops on its own. C, applying positive reinforcement to encourage calm behavior and redirect aggression. D, restricting all interaction with the animal to prevent further aggression. Answer C, applying positive reinforcement to encourage calm behavior and redirect aggression. Explanation. The key principle in behavior modification is to use positive reinforcement to reward calm and non-aggressive behavior. This encourages the animal to repeat desired behaviors and can help redirect aggression over time. Punishment techniques, say, can escalate aggression and damage the human-animal relationship. Ignoring the behavior, B, restricting interaction, D, may not address the root cause of aggression and can lead to further stress or behavioral problems. Question 19. Which of the following diseases is classified as a zoonotic disease, and why is it important for animal care professionals to be aware of it? A, canine parvovirus, because it affects only dogs and is not transmissible to humans. B, rabies, because it can be transmitted to humans through bites from infected animals. C, heartworm, because it is a parasite that only affects dogs and does not pose risk to humans. D, feline leukemia, because it is specific to cats and poses no risk to humans. Answer B, rabies, because it can be transmitted to humans through bites from infected animals. Explanation. Rabies is a zoonotic disease, meaning it can be transmitted from animals to humans, typically through bites or scratches. It is crucial for animal care professionals to understand the risks of rabies and to take appropriate precautions when handling animals that may be infected. Canine parvovirus A and feline leukemia D are species-specific diseases and do not pose risk to humans. Heartworm C is parasitic infection that affects dogs but is not zoonotic. Question 20. Which of the following is the most effective strategy for reducing stress in animals that are being transported to a new shelter? A, using a single type of transport crate for all species, regardless of size or behavior. B, providing food and water during transportation only if the animal appears thirsty or hungry. C, allowing regular stops and minimizing exposure to loud noises and extreme temperatures. D, transporting multiple animals in the same crate to minimize space requirements. Answer C, allowing regular stops and minimizing exposure to loud noises and extreme temperatures. Explanation. Reducing stress during transportation requires careful planning. Regular stops, especially for longer trips, allow animals to rest and adjust. Limiting exposure to loud noises and extreme temperatures is essential for the animal's comfort and health. Using single type of crate for all species could result in inadequate space or discomfort. Providing food and water B, should be done according to the animal's needs, but not based on appearance alone. Transporting multiple animals in one crate, D, could lead to overcrowding and stress. Question 21. Which of the following is the most critical step in ensuring proper nutrition for a shelter cat that is recovering from malnutrition? A, immediately switching to a high-calorie diet to promote rapid weight gain. B, offering a variety of food types to encourage eating without considering the nutritional balance. C, gradually reintroducing food in small amounts, focusing on a balanced, easily digestible diet. D, feeding the cat only wet food to avoid dehydration. Answer C, gradually reintroducing food in small amounts, focusing on a balanced, easily digestible diet. Explanation. When dealing with malnourished animals, especially cats, it is crucial to gradually reintroduce food to avoid refeeding syndrome, a dangerous condition that can occur if a malnourished animal is suddenly fed large quantities of food. The diet should be balanced and easily digestible to ensure proper absorption of nutrients. High-calorie diets may be harmful in this context as they can overwhelm the animal's digestive system. Offering variety of foods B, without ensuring nutritional balance can lead to deficiencies or further health issues. Only feeding wet food D, may not address the full spectrum of dietary needs for malnourished animals. Question 22. Which of the following best describes the role of environmental enrichment in animal welfare? A, it is primarily for enhancing the aesthetics of the animal's living space. B, it ensures that animals can engage in natural behaviors, reducing stress and promoting mental well-being. C. It involves the use of expensive toys and gadgets to keep animals occupied. D. It is unnecessary for well-adjusted animals in shelter environment. Answer: B. It ensures that animals can engage in natural behaviors, reducing stress and promoting mental well-being. Explanation: environmental enrichment is a fundamental aspect of animal welfare, focusing on creating environments that allow animals to engage in natural behaviors such as foraging, nesting, and socializing. This promotes mental and emotional well-being and helps prevent stress-related behaviors, while enrichment may include C. Its primary purpose is not just entertainment or aesthetics, but to fulfill the animal's behavioral and psychological needs. Well-adjusted animals, D, still benefit from enrichment as it contributes to overall well-being, particularly in confined environments like shelters. Question 23. Mr. Williams works as an animal care manager and notices an increase in complaints from staff members about their exposure to zoonotic diseases in the facility. Which of the following is the first step Mr. Williams should take to address these concerns? A. Start providing free vaccinations for all staff members, regardless of their work exposure. B. Review and update the facility's infection control protocols and ensure staff training on zoonoses. C. Increase the frequency of cleaning and disinfecting surfaces without informing staff about the risks. D. Advise staff members to avoid contact with animals to eliminate any risk of exposure. Answer: B. Review and update the facility's infection control protocols and ensure staff training on zoonoses. Explanation: the first step in addressing zoonotic disease concerns is to review and update infection control protocols. This ensures that the facility follows current best practices for preventing the transmission of diseases between animals and humans. Training staff on zoonoses and safety measures is essential to equip them with the knowledge to protect themselves. Simply providing vaccinations may not be enough without proper protocols. Increasing cleaning frequency C is important, but it doesn't address the underlying issue of staff awareness and safety practices. Advising staff to avoid contact with animals D is impractical and would reduce the effectiveness of animal care. Question 24. Which of the following is an example of how a shelter can provide species-specific care for a rabbit? A. Keeping the rabbit in a small cage with minimal enrichment to save space. B. Providing a variety of chew toys and offering a safe area for hopping and exploring. C. Feeding the rabbit only pellets to minimize dietary complexity. D. Exposing the rabbit to loud noises and other stressful stimuli to toughen it up. Answer: B. Providing a variety of chew toys and offering a safe area for hopping and exploring. Explanation: species-specific care for rabbits includes providing a safe and enriched environment that allows them to engage in natural behaviors such as hopping and chewing. Rabbits are active creatures and need opportunities for physical exercise and mental stimulation to maintain well-being. Offering chew toys satisfies their instinct to chew and prevent dental issues. Keeping them in small cages and restricting their movement is harmful to their physical and psychological health. A diet consisting solely of pellets C is insufficient, as rabbits also need fresh hay and vegetables for proper nutrition. Exposing them to loud noises D is stressful and could cause significant harm to the animal. Question 25. Which of the following actions best ensures the proper management of a dog's health records in an animal care facility? A. Writing down the dog's medical history on a piece of paper for immediate reference. B. Maintaining detailed and updated electronic health records that include vaccination dates, treatments, and observations. C. Keeping the dog's medical history in physical file with no additional documentation or updates. D. Only recording the dog's vaccination status and neglecting other medical treatments or conditions. Answer: B. Maintaining detailed and updated electronic health records that include vaccination dates, treatments, and observations. Explanation: accurate and updated records are essential for proper animal health management. Electronic health records B are the most efficient and secure way to track a dog's medical history, vaccinations, treatments, and observations over time. This ensures that care providers have access to complete and timely information. Simply writing down information on paper or keeping it in physical file C can lead to disorganization or loss of data. Limiting the records to only vaccination status D neglects other critical aspects of the animal's health and well-being. Proper documentation supports effective treatment, regulatory compliance, and continuity of care. Question 26. Which of the following factors is most important when designing an enclosure for A small mammal in an animal care facility. A. The size of the enclosure ensuring it is large enough to allow the animal to roam freely. B. The aesthetic appearance of the enclosure ensuring it looks appealing to visitors. C. The presence of interactive toys and climbing structures for mental stimulation. D. The animal's dietary needs ensuring there is always food available in the enclosure. Answer: A. The size of the enclosure ensuring it is large enough to allow the animal to roam freely. Explanation: the primary consideration when designing an enclosure for any animal, including small mammals, is the size of the enclosure. Animals need enough space to move around comfortably, exercise, and explore to maintain their physical and psychological health. While interactive toys, seed, and climbing structures can be beneficial for mental stimulation, they should be secondary to ensuring there is sufficient space for movement. The aesthetic appearance, B, is not a primary concern for the animal's well-being, though it may be consideration for the facility's visitors. Although dietary needs D important, the design of the enclosure should focus on space and enrichment for the animal. Question 27. In the context of animal welfare, what is the primary objective of the 5 freedoms? A. To provide animals with the freedom to roam unrestricted in nature. B. To ensure that animals are not subjected to unnecessary suffering and their basic needs are met. C. To guarantee animals the freedom to interact with humans and other animals as they wish. D. To allow animals to be free from environmental hazards, regardless of their domesticated status. Answer: B. To ensure that animals are not subjected to unnecessary suffering and their basic needs are met. Explanation: the 5 freedoms are a set of guidelines designed to ensure basic animal welfare needs are met and that animals are protected from suffering. These freedoms include the freedom from hunger, thirst, discomfort, pain, injury, disease, fear, and distress, as well as the freedom to express normal behavior, freedom from unnecessary suffering. B. The central goal of the 5 freedoms emphasizing the moral responsibility of caregivers to meet an animal's physical and psychological needs while roaming freely and interacting with humans. C. Can be beneficial in some cases. They are not the primary focus of the 5 freedoms. Environmental hazards. D. Are certainly concerned, but the 5 freedoms primarily address the overall well-being of the animal in managed environment. Question 28. Which of the following practices is critical for maintaining infection control in an animal care facility? A. Allowing visitors and staff to handle animals without changing gloves or disinfecting hands between interactions. B. Cleaning animal enclosures and surfaces only once a week to reduce labor and time spent on sanitation. C. Implementing strict hand washing and PPE, personal protective equipment protocols for staff members and visitors. D. Relying solely on disinfecting animal enclosures without addressing the facility's air quality, ventilation. Answer: C. Implementing strict hand washing and PPE, personal protective equipment protocols for staff members and visitors. Explanation: infection control in animal care facilities is vital for preventing the spread of diseases, particularly zoonotic diseases. Strict hand washing and PPE protocols, C, are the most effective practices for ensuring that staff and visitors do not inadvertently introduce or spread pathogens between animals and humans. Not changing gloves or disinfecting hands between interactions is a major breach of infection control practices. Cleaning enclosures only once a week B is insufficient for high-risk areas, as regular sanitation is necessary to minimize disease transmission. Disinfecting enclosures D is important but must be part of a broader approach including air quality and proper hygiene protocols. Question 29. Mr. Smith is managing an animal shelter and has noticed that many of the animals are displaying stress behaviors, such as pacing and excessive grooming. What should Mr. Smith consider as the most likely cause of these behaviors? A. The animals are sick and need immediate veterinary treatment for medical conditions. B. The shelter's environment may be overcrowded, leading to stress and lack of space. C. The animals are simply adjusting to their new environment and will improve with time. D. The shelter staff has been overly permissive and has not provided sufficient structure or discipline for the animals. Answer: B. The shelter's environment may be overcrowded, leading to stress and lack of space. Explanation: stress behaviors such as pacing and excessive grooming are often signs of environmental stress, which in this case is most likely due to overcrowding. B. Animals in crowded environments can experience heightened anxiety and frustration, which may manifest in behaviors such as those observed. While medical conditions can cause stress, the fact that these behaviors are seen in multiple animals suggests an environmental issue. Adjusting to new environment. C. May cause stress initially, but prolonged behaviors are more likely linked to overcrowding or lack of stimulation. Staff's permissiveness. D. Unlikely the cause, as stress in shelters is more often caused by environmental factors rather than discipline issues. Question 30. Which of the following practices best supports the ethical treatment of animals in research settings? A. Using the minimum number of animals necessary for research while ensuring they are properly cared for throughout the study. B. Allowing the animals to freely interact with researchers to encourage natural behaviors during the study. C. Subjecting animals to the most invasive procedures available to achieve faster results. D. Relying on non-animal models for research without any animal testing, regardless of the study's needs. Answer: A. Using the minimum number of animals necessary for research while ensuring they are properly cared for throughout the study. Explanation: ethical treatment of animals in research is guided by principles that minimize harm and ensure proper care throughout the research process. The threes, replacement, reduction, and refinement, are central to ethical animal research. Using the minimum number of animals necessary ensures that the research is efficient, humane, while proper care ensures the animal's welfare throughout the study. Allowing free interaction (b) may not always be appropriate in controlled research environment, as it can compromise the study's integrity. Invasive procedures (c) should only be used when absolutely necessary and under stringent ethical guidelines. Relying solely on non-animal models (d) may not be feasible for all types of research, but reducing animal use possible is key ethical consideration.